Imagine waking up every day feeling trapped in a fog. Joy feels distant, and even the simplest tasks feel impossible. Your own brain whispers that you're worthless, that things will never get better. This is the reality for 280 million people worldwide who experience depression. But here's what most people don't get right about it, and more importantly, how you can begin to heal. So, what exactly is depression? It's crucial to understand that it's not just a bad mood or feeling sad. Everyone feels down sometimes. That's a normal part of life, and it usually passes in a day or two. But clinical depression, also known as major depressive disorder, is a serious medical condition. It fundamentally changes your brain chemistry, affecting crucial neurotransmitters like serotonin and dopamine. These are the chemicals that regulate your mood, energy, and motivation. When they're out of balance, it impacts your thoughts, your physical body, and your ability to function in daily life. And unlike a bad day, it doesn't just go away on its own. Just how common is this? The numbers are staggering. About 1 in 10 people will experience depression at some point in their lifetime. Right now, around 4% of all adults across the globe are affected. That's roughly 280 million people. Depression can touch anyone, at any age, in any culture. While women are diagnosed slightly more often than men, it's a condition that truly does not discriminate. If any of this is resonating with you, please know you are not alone in this fight. Recognizing the signs is the first step toward getting help. A diagnosis of depression is typically made when a specific set of symptoms lasts for at least 2 weeks and significantly disrupts daily life. The core signs are a persistent feeling of sadness or emptiness, or a noticeable loss of interest or pleasure in activities you once enjoyed. But it doesn't stop there. Other common symptoms include major changes in sleep patterns, either sleeping too much or too little, and shifts in appetite leading to weight loss or gain. You might feel overwhelming fatigue and a lack of energy, find it hard to concentrate or make decisions, and be plagued by feelings of worthlessness or excessive guilt. Some people also experience a physical slowing down or, conversely, feel restless and agitated. Most seriously, depression can lead to thoughts of death or suicide. If you or someone you know is having these thoughts, it is a medical emergency. Please seek help immediately. You can call a crisis line or go to the nearest emergency room. Your life is valuable. So what causes depression? It's rarely one single thing. Instead, it's usually a complex combination of factors. Genetics and biology play a significant role. If depression runs in your family, you may be more susceptible. Imbalances in brain chemistry are also a key biological factor. Life events can act as triggers too. Things like chronic stress, experiencing trauma, the loss of a loved one, or going through a major life change can all contribute. Even certain medical conditions like thyroid disorders, chronic pain, or hormonal changes can bring on a depressive episode, as can some medications. The most important thing to remember is this: depression is not your fault. It is a legitimate medical condition, not a sign of weakness or a flaw in your character. Now for the good news: depression is highly treatable. In fact, an incredible 80 to 90% of people respond well to treatment and experience significant relief. Recovery typically involves a combination of approaches. First, there's psychotherapy or talk therapy. Cognitive behavioral therapy, or CBT, is a very effective form that helps you identify and change negative thought patterns and behaviors. Second is medication. Antidepressants work by helping to correct the chemical imbalances in the brain. They are not happy pills and should always be prescribed and monitored by a doctor, but they can be a powerful tool for recovery. Third, lifestyle changes make a huge difference. Regular exercise, consistent sleep hygiene, and a balanced diet all provide incredible support for your mental and physical health. And fourth, social support is vital. Connecting with friends, family, or a support group helps combat the profound isolation that depression often creates. For severe cases, more intensive treatments like hospitalization may be necessary, but for most people, a combination of these strategies yields the best results. If you're listening to this and think you might be depressed, what should you do? The first and most important step is to talk to a healthcare provider. They can give you an accurate diagnosis and guide you toward the right treatment plan. Early treatment dramatically improves outcomes. Next, tell someone you trust. Sharing what you're going through with a friend or family member can lift a huge weight and remind you that you're not alone. Connection is a powerful antidote to despair. And finally, be patient and kind to yourself. Recovery is a journey, not a sprint. There will be good days and bad days, and that's okay. Remember, depression is treatable. You deserve to get help, and you can feel better. Depression affects millions, but it does not have to define or control your life. With the right treatment and a strong support system, recovery is not just possible, it's likely. If this video was helpful, please give it a like, subscribe to the channel, and share it with someone who might need to hear this message. Your comments can also create a community of support for others. You are not alone, and recovery is absolutely possible. I'm Dr. Anim. Take care of yourself.